Wearing it right now. It's small, easy to put on, easy to take care of, and very convenient to use.
I was showing my supervisor today. He didn't know that I was wearing them, and so I pulled it out and just showed him how small that they are. And they're easy to put in. Just slide it in and tuck it in there, and it locks itself in. And
he was worried he was going to have to wear his hair a little bit longer, and it tucks in behind your ear really nice, and you don't even see it.
They're so
even if you're
small
wearing your
that
hair short.
They fit right behind.
Yeah.
The comfort level is something that's really easy for me to talk about. There just isn't a comparison. When I first put them on, I told the doctor, I said, do these things ever fall off? Because they're so light. And I said, I am sure that if they fell off, I wouldn't know that they're gone, other than obvious hearing loss. But I put them in, and I literally have no awareness that they're there. I mean, it's not an issue. They're so natural and so easy to put on. I just don't feel them. I don't know that they're there.
They're comfortable. A lot of times I forget that I have them on. I mean, they're very lightweight, and it's very easy to wear through the day.
There's only a little plastic tube and little very soft plastic ring inside your ear canal, and so it's very comfortable.
In fact, I can put them on in the morning and keep them on until I take them off at night. They're very comfortable. I don't mind wearing them at all. I forget that they're actually there at all.
With older hearing aids, it was always a problem in a crowd. You could hear the guy across the room almost better than the person standing in front of you. And with these, it's like being able to have a conversation again. With the old hearing aids, it seemed to create a plugged sound that, you know, eating, when I was talking, that's all I heard. And with these, I can have a conversation while I'm eating. I can talk and listen to someone else talk back to me at the same time. And it's a new life again.
Savannah was a gymnastics contest with my grandson, and here 150 kids out on the floor doing their thing, and 200 or more screaming parents. And I simply flicked to the right program, and I'm talking to the fellow right next to me and heard every word.
With the other aids, it sounds like you're in a drum or in a pipe or something, and it's just very unnatural. But with these, you actually hear your own sound coming in through the ear, and that just makes it much easier to communicate, much easier to feel natural as you're expressing yourself to people.
I have a granddaughter who's 4 years old, and she likes to play act with me. She wants to be Cinderella, and she wants me to be the stepmother. So we go back and forth. If I can't hear her, we can't play together. It just wasn't fun for me. It made me feel old and like I wasn't part of things. The teeny little voices were really getting so hard to hear, and now it's so much better with those little voices that I love so much.
In every setting that I have had where it has been difficult before, as amazing as it sounds, I have zero problems in hearing.
One of our great joys here on a Gulf Coast Journal is to be able to introduce you to women and men of great talent, especially those in whom are blended differing talents. Here's an example, a treat for the ear. Playing the piano well requires nimble fingers. Nimble fingers Herb Silverstein proudly displays. He took piano lessons as a child, but gave up playing when he went to college. It'd be 30 years before he would again touch the keyboard.
My son David brought me home a record of Chick Corea and Herbie Hancock, and he said, "Dad, jazz has come back. You better listen to this."
He listened and he sat down at the piano again.
So I started taking lessons. Had to learn one note at a time. It was very, very painful, very difficult to learn at 48 years of age.
He practiced in earnest and embraced the music he loved the most, jazz. After 10 years of practice, Herb began recording CDs of his favorite tunes.
As I became associated with a wonderful bass player, Richard Drexler, who gave me a lot of inspiration to start writing music, which I hadn't done very much of.
Richard told Herb recording cover songs wasn't enough.
What you need to do is come up with your own material. That gives it really a justification for releasing a new album.
I started writing, and in the few years that I've been with him, I've written about 20 songs.
This is the title song of his latest CD, Beach Walker.
My playing changed 100% when I met Richard Drexler, who's probably one of the best bassists in the country. I mean, he's done 300 CDs, and he's a fantastic pianist, and he's my teacher.
I know I've got a good student when I start teaching, and I learn as much myself as the student probably is learning, because, you know, they pull it out of you, and you wind up explaining things different ways.
But this is not about a struggling musician trying to find his way.
You know, he'll occasionally say something about, I could really develop as a jazz pianist if I didn't have this business to run, you know, and go to. He's got this big building and all these people working for him, and of course I know he's eminent in that field too.
All right. Hi. How you doing today?
That field is medicine.
Your surgery okay?
Yes, sir.
Any pain or complaints?
It's manageable.
Yeah.
In Sarasota at the Silverstein Institute, Herb Silverstein is known as Dr. Silverstein, world-renowned ear specialist.
We wanted to have an encompassing institute that had everything in it, where we could take care of the patient from the neck up. I can see right through her eardrum.
Dr. Silverstein is well respected in the medical field for his extensive research and innovative approaches to hearing problems. He developed a less invasive procedure to repair damaged eardrums. He invented a successful treatment for Meniere's disease.
The way I used the research was to try to help me develop new equipment, new procedures that would make our treatment for our patients better.
Exploring music is an extension of Dr. Silverstein's surgical skills. He believes one helps the other.
Many times you get into a situation where you didn't expect to see what you're seeing, and you have to improvise and make up something right on the spot to make the patient be able to hear. So that's very similar to the jazz, where you're improvising on melodies that you've created or songs that you're playing.
His musical talents also benefit his research. Proceeds from his CDs help fund his Ear Research Foundation.
We've done 9 of them, and we've raised quite a bit of money, over $120,000 over the last 12 years doing this. You want some of my music?
I would love some of your music.
Patients love it. They see the doctor, another side of him, that he's not just the doctor. This is one of my older CDs, and I've done 9 of them now.
To Herb, it's about balancing his love of music and his love of medicine.
I've been a researcher all my life, and I've developed many operations and instruments, and I'm always trying to do things better. So that's what makes medicine exciting for me.
Both passions drive him to dig deeper, reach further, discover something new.
The music is similar to that. You're always striving to play better. You're never happy, and you're trying to make it better by practicing.
To Dr. Silverstein, success is the ability to treat the ear with the art of medicine and the art of music.